Hi Jen, my name's Emily St. Clair and I'm a family nurse practitioner here in the clinic. I noticed on your chart it says that you're here with some stress concerns, so I'm really glad you came into the clinic and came to talk to me. I'm curious to hear more about what some of the stress concerns you're having.
Well, I'm a full-time grad student, and I have a husband and 2 kids, and I work and I do clinical. And the last few months I've been feeling like I have more stress and anxiety. Usually in the evenings I have a few glasses of wine to help me de-stress, but over the last month I've noticed I've been drinking the entire bottle, sometimes even 2, almost every night. It's starting to cause some tension between my husband and I, and I'm concerned it may not be a good habit that I'm developing.
Okay, so what I'm hearing you say is that you're concerned about your stress level that's becoming increasingly difficult to manage, and you're concerned that your alcohol consumption is increasing due to your stress level. I'm also hearing you say this is concerning because it's beginning to cause stress in your marital relationship. Is that correct?
Yeah, that sounds about right.
Okay, well, let's talk a little bit more about this if that's okay with you.
Sure.
Okay, so I noticed on the questionnaire that you filled out that you were drinking about 10 or more drinks in 1 week and about 3 to 4 drinks in one setting, depending on your stress level. Does that sound right?
Yeah, a lot of my drinking lately has been just because I'm so stressed. I tend to have wine at dinner, which becomes more and more, and it becomes even harder to de-stress.
Okay, so according to the sheet, your score is 3, which just means that you could be at risk for increasing stress and the possibility of some physical ailments that could be related to your alcohol consumption. This sheet says that women can be at risk for alcohol-related problems when they drink more than 7 drinks a week or more than 3 drinks in one setting. So it sounds like as you're getting more stressed, which that's what is causing you to drink more, according to this tool, is placing you at risk. What do you think about all that?
Well, I thought red wine with meals was more of a healthy choice, and 7 in a week doesn't really sound like that much to me.
Yes, 7 in 1 week does sound like it's a little less than what you've been drinking and what you've considered to be healthy. There can definitely be conflicting information that we get about the amount of red wine that's good for us and the amount that can cause health problems for us. But I imagine right now that the increased stress level that you're having is what's most concerning for you. Is that right?
Yeah, it's definitely giving me anxiety and causing everything else, including my drinking, to get worse.
So if it's okay, can I just ask you what you like about alcohol?
Sure. It helps me reduce more stress, relax, and kind of zone out. I also like the taste of it, especially the more expensive wines.
So you like the way it eases your stress and the taste. What are some things you don't like about alcohol?
I don't like that I feel tired the next day and that it's starting to make me feel guilty because my family doesn't like it when I drink every evening. It's also getting pretty expensive because I tend to like the more expensive wines, which adds to my financial stress too.
Okay, so if I'm hearing you, on one hand, alcohol helps you relax and de-stress, but on the other hand, it adds stress to your family and financial life. Is that correct?
Yeah, I guess it's kind of a catch-22 for me.
So what do you make of the kind of teeter-totter effect alcohol is having on your life, both helping and contributing to your stress?
Well, it's starting to make me feel like maybe I need to find some other way to deal with my stress. If I can deal with my stress, I know my drinking will decrease. It's never been an issue for me.
So it sounds like you want to make some changes. You have in the past. So right now, on a scale of 1 to 10, how important is it for you to make some changes so that you're drinking less and managing your stress better?
Probably about a 7. My family is really important to me, and I need to be healthy so I can keep up with my schedule and responsibilities.
So I'm hearing that it's pretty important to you right now to make some changes. And how confident are you feeling right now that you can make some of these changes in your life to help you manage your stress and decrease your drinking?
Pretty confident, probably a 7 or an 8.
And what would be your choice in this approach? Would you rather quit drinking altogether or just cut back? What are your thoughts?
I'd rather not have to quit drinking altogether, but I would like to be able to cut back. I know I can be less stressed. If I'm less stressed, I won't want to drink so much.
Okay, how ready are you feeling to make these changes?
I think I'm pretty ready. I mean, it's been feeling it's starting to really affect my life, so I just can't continue like this.
So I'm hearing you say you're feeling ready to make changes, and I imagine you've probably already thought about some of the things that could help you manage your stress. Is that right?
Well, yeah, I thought about exercise, but it feels like a big commitment right now. Maybe just having someone to talk to about things that are going on in my life. Sitting and talking about it usually seems to help really lower my stress level.
That sounds like a great idea. We do have a behavioral health specialist that offers some counseling sessions, and she might be a person who can sit down with you and help you talk through some of these stressful areas of your life. I can make an appointment with her for you today before you leave if that's something that you'd be interested in.
Yeah, that'd be great.
Great. Well, I wish you well. It sounds like you're very committed to making some changes. I think you're going to do very well. I look forward to following up with you on your progress in just a few weeks. Does that sound like a good plan?
Yeah, that'll work.
Okay, great. Well, it's very nice to meet you, and I look forward to meeting with you again soon.
Thank you.